All right, if you're working in Pharma QA, production, or a pharmacy, you're going to want to listen up. The rulebook is getting a major rewrite. The United States Pharmacopoeia 2026 Issue 1 is here, and trust me, it's not just some minor tweak, it's a really fundamental shift. So today, we're going to break down the 5 critical updates you absolutely have to know to stay compliant, from a whole new way of thinking about weighing to a massive shift toward digital data. Okay, let's dive right in.
I'm just going to kick this off with a very direct question, because this one has a non-negotiable deadline. Are your balances ready for February 1st, 2026? Is your sterile compounding process up to snuff with the new standards? You know, if you even paused for a second to think about that, you definitely need this explainer, because the clock is officially ticking.
First up, and this one is a huge deal, is what I'm calling the weighing revolution. This all centers on the revised General Chapters 41 and 1251. And here is the date you need to circle, highlight, and put on every calendar. As of February 1st, 2026, these new rules are mandatory. No grace period.
So, what's actually changing? Well, think about the old way of doing things. That simple, once-a-year check on your balances. Yeah, that's gone. Forget about it. The new approach demands periodic, risk-based calibrations. This means you can't just set a calendar reminder and call it a day anymore. Nope, you have to actively assess the risk for each and every instrument to decide how often you calibrate. It's a huge move from a passive check-the-box model to an active compliance model.
Now let's talk numbers, because this is where things get really specific. For the very first time, USP 1251 is giving us a hard number, a quantified safety factor you have to apply. And that magic number is 2, for balances used in stable lab conditions. If you're using automated systems, it's 1.5. And let's be crystal clear, these are not suggestions, they're mandatory new requirements for all of your calculations.
So here's the bottom line. You need to go pull up your standard operating procedures like today. If they still talk about fixed calibration intervals, annually or quarterly, without any mention of a risk assessment, you are driving straight toward a major compliance gap. This is probably the simplest but most critical check you can do right now.
And this whole idea of stricter, more risk-based control, well, it doesn't stop with weighing. That brings us to our second huge update, the massive overhaul of USP 797 for sterile compounding. If you are anywhere near the world of compounding, this is a really big deal.
The 2026 cycle is rolling out a much stricter framework. And right at the heart of it all is a brand new requirement, a dedicated compounding supervisor. This person is now responsible for overseeing the whole shebang. We're talking the new categories 1, 2, and 3 for preparations, much tighter beyond use dates, more microbial sampling, and way more personnel training. It's a massive increase in direct oversight.
And speaking of personnel, the days of one-and-done training are officially over. It's now a continuous validation process. The new standard is demanding stricter aseptic training, more frequent media fills to simulate the real thing, and yep, mandatory and frequent fingertip sampling. This is all to make sure aseptic technique is top-notch all the time. The bar has been raised, big time.
Okay, on to update number 3. And this one, well, this is genuinely a historic shift for the USP. We are officially moving away from a world of physical documents and little glass vials and jumping headfirst into the era of digital quality standards. This isn't just a new rule, it's a whole new philosophy.
So, the star of this show is the new Digital Reference Standard, or DRS. What the heck is it? Well, it's actually pretty cool. Instead of getting a physical vial in the mail, you get a data package. That's it. It's an official USP standard that's designed to plug directly into your lab information systems and other digital workflows, making your quality data seamless and totally machine-readable.
And this quote right here, it really says it all. Your entire approach has to shift from being document-centric to data-centric. So here's your practical homework from this section. Start talking to your IT departments and your software vendors now. You absolutely have to understand how your current systems are going to handle these new digital standards.
Now, let's switch gears a bit and talk manufacturing. Our 4th critical update also comes with another one of those hard deadlines. So get your calendars out and mark down May 1st, 2026. That's the day USP 665 becomes mandatory. This is all about the plastic components you use. We're talking single-use systems, bags, tubing, you know the drill. You'll now be required to have a data-driven risk assessment for any potential leachables coming from that equipment.
Okay,
Our fifth and final key update is for all of you in regulatory affairs and market access. The USP drug classification for 2026 is final, and it really shows how the pharmacopoeia is trying to keep pace with innovation. We're seeing brand new categories like kidney agents and new classes for recent breakthroughs like RSV agents and menin inhibitors. And listen, this isn't just administrative paperwork. This directly impacts how medications get classified and, importantly, covered by payers. It's absolutely critical for your regulatory filings.
Whew, okay. That was a lot, I know. We've covered a ton of ground, but you can see the pattern, right? The USP 2026 update is all about a strategic shift towards better risk management and deep digitalization. So let's boil it all down into a clear action plan for what you need to do, like right now.
Here is your immediate to-do list. First, tackle weighing. Update your SOPs for risk-based calibration and calculate those new safety factors for every balance you have. You need to do this now to hit that February 1st deadline. Second, for sterile compounding, you need to kick off a full audit of your compliance to USP 797. And third, start planning for the future. Get those meetings scheduled with your IT team about integrating DRS and get a head start on your risk assessments for USP 665.
So I'll leave you with a question to take back to your team. Looking at this shift to risk-based weighing, the total overhaul in sterile compounding, or this big jump to digital standards, which of these updates do you think will be the hardest for your team to actually implement? Answering that question for yourself now is your absolute best first step to staying ahead of the curve. Thanks for watching.